who passed away recently, Thich Nhat Hanh spoke about interbeing and the close relationship between all spirits. And I think that the tagline there, when we protect one, we help protect all, should really drive that broader notion of love for planet and love for all species, since we all benefit when we improve the health of our climate. The next slide lets you know about some of our major California landmark plans when it comes to adaptation, resiliency, and soon mitigation. And so you should be aware that we are statutorily required to release every 3 years an updated climate adaptation strategy. This started in 2009. It's led by our Natural Resources Agency and the Governor's Office on Planning and Research. And our office within public health has really helped bolster the data, the public health and safety protections to accelerate nature-based climate solutions and help with decision-making that's utilizing the best available climate science and partnering across as many sectors as possible. On the right, you see the state's extreme heat action plan that outlines a strategic and comprehensive set of actions. And again, our team has been working to help infuse health and equity into all policies, but especially these landmark policies. The next slide shows this crucial number you may have heard of, 1.5 degrees centigrade, and how there's a link between mitigation as well as adaptation with the shrinking window for action. It is the role of the healthcare sector and public health to work together to deal with all three. If you think of COVID, we need prevention with masks, with indoor filtration, with boosting immune systems, with healthy bodies. And then when we do get exposed, antivirals can lower that viral load, can decrease the assault on the human immune system, can decrease long COVID and disabling conditions over time. It's the same when it comes to our planet and our environment, the need for simultaneous mitigation as well as adaptation. But primary prevention really is the most cost-effective way, and that's mitigation. And you'll be discussing healthcare decarbonization in future parts of this series. The next slide shows California's landmark goals for achieving carbon neutrality. And this goes back to 2006 with Assembly Bill 32, the Global Warming Solutions Act. What you could see was reaching 1990 levels by 2020. This was achieved 6 years early. The next goal is getting 40% below 1990 levels by 2030, and then ultimately achieving carbon neutrality no later than 2045. On the right, you see the pie chart contributions, and healthcare has many interactions from transportation to our pipelines, from our contracting, from industrial facilities. And so we are part of the problem, and we can be part of the solution by lifting the veil on where our emissions contributions come from. That can be anywhere from 8 to 12% of the global burden, since we're such a major player economically. Lot more to come on this, but this is to show that as goes California, so goes the nation and the world with bold mitigation goals. And it's up to healthcare to join that journey as well. If you just look at transportation and its major contribution, the next slide will show when we take a multi-benefit approach, we can see that active transportation, tripling the amount of walking, cycling, biking, scooting that humans do in California from less than an hour to say an hour and a half per day when you add it up with commuting and joy walks, can not only prevent chronic disease and improve mental well-being, it saves a lot of lives and a lot of dollars. So this was our economic modeling in partnership with the California Transportation Plan for their 2050 goal. If we are to achieve that goal of tripling the amount of active transportation that Californians do, we can save almost 8,000 lives per year, reduce the burden of chronic disease, and save between $52 and $170 billion. On the right, you see the population attributable fraction, the decrease in disability adjusted life years. And so this type of multi-benefit where when you take active transportation, you have fewer emissions, you have greater health, you have an overall impact on health and well-being and decreased healthcare utilization, that triple bottom line win is what we're going for. The next slide talks about the moment we're in right now in September of 2023. And I'm so glad that policy is one of the 4 strategic priorities of this UC Climate and Health and Equity collaboration. Well, as of this week, we're happy to announce that Governor Newsom and Attorney General Bonta have formally sued big oil companies, Exxon, Shell, Chevron, ConocoPhillips, BP, and the American Petroleum Institute for disinformation, 50 years of deception, cover-up, and damage that have cost taxpayers billions of dollars in health and environmental impacts. Who should pay for that? Not taxpayers, not healthcare, the companies that created the deception and the pollution. Should we take pages out of the tobacco playbook from last century that really saved lives, lengthened life expectancy, got into homes and apartment buildings and healthcare facilities and airplanes and restaurants to make us more healthy and resilient to the environmental impacts of tobacco? Can we do the same for climate? Absolutely. And California is leading the way. There's several pieces of legislation literally on the governor's desk as we speak today, including Senate Bill 253 from Senator Scott Wiener about climate corporate data accountability that would require entities with more than $1 billion in annual revenue who do business in California, that could include healthcare organizations, to report all scopes of their emission, not just scope 1, the direct ones, but more importantly, scope 2 and 3, the indirect effects of the supply chain. That lifts the veil so we know to what extent we're polluting. That's where you can ask your organizations to voluntarily use the benchmarking tool, voluntarily share their scoped emissions of all 3 phases before it becomes law, and be able to ultimately support carbon neutrality. So very happy that the governor's taking a close look at some legislative cleanup before considering signing this piece of legislation. Again, as moves California, so moves the nation and the world. The next slide talks about the climate change 5th assessment. We've had 4, and you should be aware of this 5th assessment that really wants actionable science, what you all as healthcare practitioners and researchers are a key part of, but that we can get it down to a granular level for local decision makers using some of our geospatial tools so we can understand both adaptive capacity, vulnerabilities, and resiliency measures for Californians. It can focus on tribal and indigenous communities, justice and ocean and coastal areas. And we invite you to virtual regional workshops taking place in October to join in these academic and government partnerships. The next slide really answers the heart of our session today, which is the public health response to the climate crisis. And this is the Situation Room. It's a photo I took a couple of weeks ago when I was there for a training. This is where the governor gave a lot of his press conferences during the COVID pandemic. And it's where public health, the Emergency Medical Services Authority, healthcare services, and many engage in that multi-sector response. We follow the incident command system, which is led by FEMA, Federal Emergency Management Association, that really starts at the local level. And when a local jurisdiction, a city or county, can't handle a threat, an earthquake, a communicable disease, a power shutoff, a climate threat like flooding or heat or wildfire smoke, they then go to the region. And if the region can't handle it, it then goes to the state. So at the state and local level, public health is in the Situation Room where decisions are made to really champion data, coordination, communication, and preventive messaging. So it's that constant cycle of planning, training, response, and recovery. And it's really the 2 big C's of coordination and communication to get the word out. And that's where the partnership between healthcare and public health can be so important. So as a former local deputy health officer, I was in the command station at the sheriff's department when there were power shutoffs and we were concerned about reaching vulnerable seniors who relied on power for their durable medical equipment. Or there was the combination of COVID and wildfire smoke and heat, and you had low-income seniors who didn't speak English in the 7th story of an apartment building who maybe didn't have cooling, and we had to evacuate them and get them to a safe location. So response is multifaceted, and I'll give you a few examples at the state public health department of how we're engaged. We have an occupational health branch that looks at facilities as well as ways to improve the health of workers. We have the Center for Healthcare Quality that looks at preserving the health of facilities, long-term care facilities, skilled nursing facilities, communications, the Center for Environmental Health that does assessment, guidance, and testing. We focus with our federal, regional, and local partners from CalEPA to the Air Resource Board to the Office of Emergency Services. We work through the Medical and Health Coordination Center through Emergency Services Function 8 to really focus within that domain. So that's a snapshot of how we respond. And what we're seeing is it's really all hazards, all season. When I started in this work, it was a one-day earthquake course. And quickly it changed its name to an all hazards course. And now it's really the climate crisis that's driving the majority of these emergency responses. So we need to be activated pretty much year round. The next slide is an example diving a little deeper into the extreme heat 10-day period that we had last Labor Day, where we had to put out guidance documents. Do we send kids to school? Do they have outdoor sports practice? How do we partner with the National Weather Service? What's the best app to use a color scheme to look at air quality or look at a heat index? And so we partnered to get guidance documents out to multiple sectors, childcare facilities, education, workers, particularly those with greater risk. The next slide shows how California came together. If you were here on September 6th last year, then you may have gotten that wireless emergency alert asking us to conserve energy to help avert some power blackouts. That was a communication and coordination intervention to preserve the grid. The next slide goes into some of our tools, such as the CHVIZ, the Climate Change and Health Vulnerabilities Indicator that helps with granular geospatial mapping down to the census tract level. Here you see data from Los Angeles where we can disaggregate by race and ethnicity and also by census tract to really know which neighborhoods and populations are at greater risk, in this case, from a concentration of particulate matter 2.5 microns. Next slide shows another tool where we can, on the top right, look at the combination between exposures, like heat, and sensitivities, like older adults. And in purple, you can see that high level of the combination of exposure and sensitivity in Placer County outside of Sacramento, with almost 1/3 people looking into the future. That may help us know where do we focus and prioritize our resources for public health planning, readiness, and response. The next slide shows when we track climate and health impacts, recent data from Healthline looking at emergency department visits. It's more than just heat-related illness. When we look at the broader conditions of chronic conditions that are exacerbated, diabetes, urinary tract infections, electrolyte abnormalities, it's much greater than what the data show. So in the spirit of improving our more real-time accurate information, as you see on the next slide, we are standing up a statewide climate syndromic surveillance program, participating in the Center for Disease Control's BioSense program. This will allow for better real-time notification from emergency departments. So just like if there's an emerging variant that we pick up in an airport or in groundwater surveillance, wastewater surveillance for a respiratory condition like flu or COVID, we can have our Sentinel antennas up to be able to understand the impact in the moment of climate-related threats. It'll take several months to years to onboard all the facilities in California to these systems, but we are embarking on this journey. That is also part of response, is accurate data. The next slide shows an example of getting into homes, home weatherization and energy efficiency services, working with a diverse workforce like community health workers or promotoras. This is a pilot project from Tulare County where we're connecting farm workers and low-income residents with energy efficient homes. You know, I can relate to at night clicking refills on albuterol and wanting to decrease the need for some of those medications by having a healthy and insulated home from the threat of gas or wildfire smoke, tar, particulate matters. And so this is part of prescribing those more upstream healthy homes, healthy families, healthy neighborhood conditions. And there's ways we can get that triple benefit. We lower utility costs so people don't have to choose between paying for food, prescription medications, and their utility bill. We lower greenhouse gases, and we lower the threat on their health all at the same time, that triple win approach. As we move to the end of this talk, we're going to start talking about actions and ways that you can partner, starting with local public health. There are so many touch points from climate action plans, general plans that decide where sidewalks, bike lanes, food deserts are dealt with and built, how we can mitigate hazards from a public health and healthcare lens, And there are many sectors that we can collaborate with and get involved in education campaigns. The next slide shows how you can partner with local health representatives working on some of those upstream factors. And there's a variety of state funding to the community level that you can help support and be a part of. The next slide gives an example of some of those state investments across the state, from affordable housing to low-income weatherization, to transformative climate communities, to urban greening by providing more shade for cooling and active transportation. So we've supported many of these funding investments now in the billions by adding an equity and a health framework, and we encourage you to partner with your local public health partners. The next slide shows some of the benefits of all of those investments. Since 2014, those cap and trade dollars in California being put to work have totaled almost $10 billion with a lot of different health benefits. The next slide will share how you can see those various strategies on the left are really investments in health determinants. And you can see on the right how health conditions are improved when we focus on the policy systems and environment changes in other sectors. So I encourage you with the next slide to find your entry point. Perhaps it's a vulnerable population that you work with through your research or practice. It's a health condition that you may be a specialist in or interested in. It could be a program that you focus on, like preparedness or accreditation or health impact assessments, or a climate exposure that relates to your specialty in your field. Next slide reminds us again that it is our obligation to take on this work. So I'll end with 5 action steps that we can all take. Next slide shows action step number 1, decreasing emissions by decarbonizing. And the next session in this series will go into a lot more detail. But look at the contribution from scope 3. That's what we need to share voluntarily by our organizations, universities, and hospitals to be part of the solution, and to sign that pledge from Federal Health and Human Services. Kaiser did so, and many others can as well. The next slide shows how we can encourage education of patients and staff to get involved in being part of the solution. And the next slide has a great resource from Medicine for a Changing Planet with a series of clinical case studies. We can embed them into our curriculum so we can see that relationship that 93% of you noted, that you're starting to see it impacting your patients right now. The next slide in action step number 3 talks about partnering with community-based organizations and local public health through a variety of upstream engagement opportunities with that multi-win frame. And the next slide shows action step number 4, how you can become a climate-focused healthcare organization, having climate-smart policies, taking inventory of your organization's emissions, being a leader or calling for a climate officer or a sustainability officer if one doesn't exist already. The next slide talks about how you can become a climate-focused healthcare professional by joining organizations like Climate Health Now and championing this work within your own sphere of influence. And the next slide shows a variety of those organizations from universities within California and nationally, touch points that you can be a part of to support climate health for climate resilience. So we'll go to the next slide that, again, ends with the tagline of action with urgency and hope. I want to thank our team, Linda Helen, Dan Wu, the entire Mighty Climate Change and Health Equity team, and encourage all of us to act with urgency for collective action, to bring hope, which is the antidote to despair. And may we act for love of planet, for love of people, especially the most disadvantaged, as we support dignity for people's lives, while simultaneously doing mitigation, adaptation, and resiliency. May we support transformation of our systems, our organizations, and ourselves through this broader view of One Health. And may healthcare and public health join hands, just like we did during the pandemic, to take on the greatest health threat of our century. And forward to looking to some conversation with you, and we'll move to a final Slido poll where we can ask you what action you may take. So pull out those phones again, scan the QR code. I never give a talk without a call to action. What is one action you will take? It could be research, education of self or patients, joining a climate health organization, leveraging an entry point that you saw in the presentation today, partnering with public health or a community-based organization, asking your academic institution or hospital to voluntarily share scope 3 carbon emissions, requesting a climate officer, or an action plan? Within your sphere of influence, please share with us what is the action that you will take. And with that, I'll pass it back to Katie. Thank you.
Thank you so much, Dr. Radhakrishna. That was an incredible presentation. I know I speak for everyone when I say so. I really appreciated your focus on hope. As a parent, I often find it hard to remain hopeful when thinking about the climate crisis, and yet it's such an important component to keep me engaged. And I think bidirectionally, really taking action has helped me find that sense of hope. I'm going to move towards the chat so we can get some of these great questions out there. Speaking to kind of some more specific public health initiatives, this is from Andrew Wen. It's no longer a reach when we say housing and car-dependent urban planning is intrinsically tied with climate health. What is CDPH doing to support densifying and building more housing in certain California communities that where people can afford to live in resilient areas rather than continuing to build outward?
Yeah, thank you so much for that question, Andrew. That is really health in all policies. At the local level, we just didn't have time to get health professionals and health officers to testify at the local general plan meeting or the local hazard mitigation planning meeting, or when we're looking at where to build housing. But you named two of the solutions. Infill. If scarcity is the problem for housing, density is part of the solution, and adaptive reuse. Now, using that multi-benefit triple win frame of, for example, putting essential services and dense housing near where we play, pray, work, enjoy our recreation is so important. And that can happen at the local as well as the state level. So our agency sits on the Strategic Growth Council, whose mission is to create thriving, sustainable, healthy communities. And we work with all 7 other secretaries from Transportation and Housing and Natural Resources and EPA to leverage the health and equity voice to make sure we're measuring those multi-benefits when we're trying to do just what you said, which is infill development and adaptive reuse to really create a California that works for everyone. Great question.
Here's another question from Paulina Nava. Are there any plans to build local health department and community health worker or promotora capacity, such as funding local climate and health equity programs?
Yeah, great question. We have a 15 by 25 initiative, which is to hire 15,000 community health workers, promotoras, or community health representatives. We've learned this from tribal indigenous communities. We've learned this from the global health space, where there's ASHA workers in India or accompagnateurs in Haiti. Costa Rica has a primary care physician and a health worker for every member of their society. Wouldn't it be great if California was the first to do that, to lengthen life expectancy? So we are on the path to do that. We're starting with a generalist certification, and there will be specialty certifications, whether it's in mental health, for aging, for climate as well, to really empower those trusted community members. But as you saw with our pilot in Tulare County, we're already working with community health workers to help weatherize homes and make them climate resilient. But they are absolutely an essential part of our workforce and our future solutions here in California.
Maybe I'll try to get one more in. From Enrique Huerta. Extreme heat is made worse by the urban heat index effect. The urban heat index effect kills more Californians than all other climate and weather-related hazards. Why does the heat health connection to urban heat get buried in a larger conversation about heat and its secondary impacts?
Wow, such an important question, which really strikes at communications and narrative. Just this month, we brought all the local health department equity leads, and next month, we're getting all the health officers together for communications training. Narrative, messaging, and framing is so important. Whether we're interviewed or we're framing the abstract or we're giving an academic presentation, being able to tell the story of those historic harms like redlining that leads to the disproportionate health impact of the urban heat island effect is so important. We have to make it catchy and memorable and evidence-based and use data, but also use storytelling and empower people whose lives are affected by it to actually tell the stories themselves. But again, we are trusted more than other professionals in America, so it's really up to us to improve our own storytelling, narrative, and communication skills to connect the dots for the multiple overlapping cumulative harms, and more importantly, the multi-benefit solutions.
Wonderful. Well, I see we are at time. It's 1:01. Thank you again, Dr. Radhakrishna, for this wonderful presentation, and for everyone who is here. We had about 100 people here today, and we're just so honored to have been able to hear your talk. Before we close, I just want to let you all know we do plan to share the recording with you all, and we also look forward to seeing you at our next webinar in October. Thank you, everyone.